Missy and Caitlin. I work full-time as a staff nurse at Ellis Hospital in Schenectady in the ICU. And I also teach clinical as an adjunct for SUNY Del High freshman students on Mondays.
And I am Missy Ackerly. I teach in the nursing labs at the School of Nursing in the face-to-face ADN program, the pre-licensure program. And I do not go to clinicals, so it was very exciting for me to go to RAM.
I'm Caitlin Kilts, and I'm part of the same cohort as they are. And I'm a professor in the ADN program at Del High. And I work per diem, so not very often, at Bassett Medical Center as an inpatient float nurse.
Okay, so just so you know, we took this trip back in November with Dr. Kirsty Digger as part of our MSN program potential requirements. It didn't, we weren't required to go, but in order to get some hours, we did go, and it was actually a fabulous trip. We are offered the opportunity to go again in May. I am definitely going. I've signed up, and it has nothing to do with getting course credit. It has more to do with being a volunteer in such a worthy cause and worthy organization right here in our United States. So Caitlin has a little clip that she's going to show. You want to give us a little intro there, Caitlin?
Yes, but one second. I think there may be a child running behind me in a moment.
Okay.
A heads up.
Adam, I have two cats next to me, so.
I haven't had the cats jump on me yet, but we'll probably get there. Okay. I'm sorry. I have to figure out technology.
Okay.
Share screen.
Missy, where is the next RAM clinic going to be located that you're going to?
It's actually down in Virginia again, and it's in something county. What is it? Warren County? It's near Wise.
Okay.
So there's a big RAM event in Wise, Virginia every year.
And it's what, May 5th?
May 3rd through the 6th.
Mm-hmm.
So I think we're leaving on the 4th, and we will be returning on Monday the 6th.
Okay. Are we all set?
All set.
Okay.
Millions of families are living in a crisis because they cannot access health care. Millions of people live in pain, suffering from preventable disease and hardship. Remote Area Medical, RAM, responds to their needs by providing free quality mobile clinics. In less than 12 hours, RAM turns schools, stadiums, jungles, and arenas into fully functional medical centers able to provide dental, vision, and general medical care to thousands. Families are so desperate for this care that they begin to line up 48 hours before a RAM clinic begins, often sleeping in their cars to make sure they get one of those precious numbers which will ensure them entrance. For many, a remote area medical RAM clinic can mean the difference between life and death, between securing a job and struggling to make ends meet. For some, it means providing for their family and improving their quality of life. And for every person who receives care at a RAM clinic, it means stopping the needless pain and suffering they have to deal with every day. Our mission is fueled by private donors and driven by the power of volunteers. They join forces to support people who have nowhere else to turn. We all face hard times in life, and everyone needs a helping hand at some point. RAM extends that helping hand with a mission to provide free quality health care to those in need. RAM works with local partners called community host groups. A community host group gathers resources, rallies sponsors, and recruits volunteers on the local level to ensure a successful clinic in their community. RAM works to empower and equip these local partners to fulfill their own mission and purpose. As a result, RAM and communities converge on a shared mission as we roll up our sleeves and address our problems head on. Together, we can make a difference, and together we can lead hurting people to a better future. As local leaders prepare for the free RAM clinic, they work directly with experienced RAM staff to build effective strategies and address the crisis their community faces. They need to understand the scale of the clinic and what it takes to provide quality care and follow-up. The demands of the clinic include an appropriate venue to facilitate the hundreds and perhaps thousands of potential patients, water and electricity, security, logistical support for patient and volunteer flow, food and lodging, all must be organized, and RAM helps the local community host group to stay on task to achieve our shared objectives. By joining with a community host group, RAM is able to offer a turnkey, comprehensive clinic using millions of dollars worth of mobile units and equipment and a cutting-edge registration system, as well as experienced RAM personnel. RAM also shares the burden of cost with the community host group, so the expense of the clinic does not drain local resources. RAM has always worked to bridge gaps in our healthcare system. A person who needs a dentist cannot go to the emergency room to fix their teeth, and a person who needs an optometrist cannot go to a walk-in clinic to get a pair of glasses. Many families cannot afford their insurance deductible. Unfortunately, RAM may be their only source of health care. When a patient comes to a RAM clinic, they may face a long wait in line, but they receive professional medical services, and it's free. They meet doctors who want to help them. They meet people who care. When patients leave, their suffering has been eased, their hope has been restored, and their lives have been improved. They often hug volunteers, thanking them for providing what they needed but couldn't afford. Volunteers leave the clinic knowing their help was needed and appreciated, and the experience brings fulfillment and joy to their lives. Remote Area Medical is a pioneer of no-cost healthcare, and we continue to set the pace to create a better and healthier future for the underserved communities in this country. I started RAM to serve those remote areas of the world that have no access to healthcare. But then I discovered that there were millions of impoverished people right here in the United States. So we've become the champion of the sick and the poor and the underserved, in fact, the voice of millions of people who simply cannot get the care that they need. So you can become part of something that makes a real difference and help us bring free, quality health care to millions of children and their families. Please join me on this compassionate journey of hope, and I do trust that I can count on your support. Thank you very much.
And that was Mr. Stan Brock. He is the RAM founder and president of the RAM Remote Area Medical. And he is just an amazing person. He has rallied the troops. He has rallied professionals and volunteers to help people right here in our United States. So we went to Warsaw, Virginia. This is an area that was very underserved. Am I sharing my screen yet?
No.
Okay.
Were we going to show the clip from the patient's perspective, or will we do that later?
In a little bit.
Okay.
And here we go. And share screen. Is that better?
Yes.
Okay. So while we were at the event, we arrived at this event, and I just love this slide because it really just takes me back to those days where we all sat in the same room and worked with so many different professionals. It was such an organized event. and seeing the faces of some of these people that we were able to help. There's one significant thing that struck me the whole time I was there is how many young daughters were with their dads and bringing their dads in for care. And even a few moms bringing all of their children in for care. They couldn't get eye glasses. They didn't have dental care. They waited 2 years from the event that they went to prior, the RAM event that was in Wise, Virginia. They heard about this one. They traveled overnight. They slept in their cars. They waited in the parking lots. Each and every one of these people were so grateful to be there. They were all smiling. They were all happy. They were all receptive. They were all very open and very excited to be receiving the care. This was our first morning. This picture just speaks volumes to me. The area was so very beautiful, very beautiful. This was the first morning that we were heading over the bridge, this very long bridge across the bay to the clinic. The clinic was held at an elementary school, and it was about 5 miles, I guess, from our hotel. And waking up that morning so early and looking out at such a beautiful area, and then realizing how much was underneath the surface of healthcare needs in that community and around that community, and how many people in our United States really, really are deprived of healthcare or inadequate healthcare or underinsured.
Missy, I'll just add one thing. I was surprised because the area itself did not appear to be impoverished. But the people that traveled, some of them traveled from rural areas quite a distance. So looks can be deceiving when you go into a neighborhood and it looks fairly affluent. The school was beautiful. But then some of the people that came in had no health care.
Absolutely, Donna. And actually in this United States, 60% of people who are underinsured or uninsured are in rural areas. 60% of our population. There's either access to healthcare is limited, or the actual healthcare is limited, as well as being underinsured or uninsured.
Mm-hmm.
Go the right way. So this was the evening that we got there, and we were met by one of the organizers and given a tour. The evening that we got there, the clinic was going to be started the next morning, and the dental area was being assembled, and we were taken on a tour through the school. You can see there are several of us in the hallway, and we are asking questions and getting oriented to the space that we're going to occupy and finding out what our assignments were going to be. And to the right, you can see that this was the dental area. The gymnasium filled the dental area. This is only one picture of one line of chairs. I think what did we count, Donna? 18, 20 chairs at least.
There were 2 lines, so yeah.
Yeah.
Probably about 10 to a line.
Yeah, there at least. And there were patients in these seats the entire time we were there.
And it was amazing to watch them rolling out everything. I mean, they literally came in big trucks, and within a few hours, they'd set up a medical clinic. They have it down to a fine art. It was really quite amazing.
You can kind of see their carts in the background over by the basketball hoops. Those are the carts that these seats fold up and collapse into these nice portable units. The tables fit in there. Everything is pieced together to fit into those mobile units that you saw earlier, exactly right, so that they can go from clinic to clinic to clinic. Everything is cleaned and taken care of before they put them away, so they are ready to go for the next trip. You can see Dr. Digger smiling away. And this is just a picture of some of the areas that we utilized while we were there. The elementary school was quite large, and it was a locker room actually area that we had our food buffets were served to us on. the top surfaces of those lockers served as buffet tables. And as you got time, you go and you try and find some food. Somebody would tell you, hey, take a break, go take a shift. There's Monique in the picture on the right. She was also with us. And when you get a break, you grab your camera, try and get some pictures, try and meet some people, and go take 5 minutes off your feet. Donna, Caitlin, anything on that one?
No.
Okay.
It's a very silly thing to say, but it was amazing how good their food was and how generous they were. There was one wonderful woman who worked, I believe, in the cafeteria at the school that provided and cooked all of the food, and it was just fantastic.
That's right. That's right.
And it was the fall, so there were a lot of apples.
Yes.
And this is our triage area. This is our crew. We're all together here. We have Karen Armeo, we have Caitlin Kilts, we have me, Brian Lewis in the back, Christine Dunning in the front, and there is Donna Florkiewicz.
So we're missing Monique from that picture.
We're missing Monique from that picture and Dr. Digger. I'm not sure where she was. I thought we stayed. Oh no, she hadn't arrived yet.
Oh, that's right.
We drove separately. And then, because that was a whole nother event, was just the travel there was fabulous, getting to know each other and having a good time together. And to the right, this is the area that we triaged in. These little children chairs and tables, and each table was set up the same with glucometers, gloves, bags of gloves. The supplies were very limited. What else did we have on the table?
The paperwork.
Forms, our paperwork forms, and Donna has some explanations about that she'll provide in a couple of minutes.
Yeah, blood pressure cuffs.
Yeah.
So one of the supplies that we had a problem with was the blood glucose strips for the monitors. There was a variety of different types of glucometers. Some of the strips that we had didn't fit the meter that we were given, and some of the strips that did fit the meter ran out quickly. So, it's not like in a hospital where you had unlimited supplies. We had to make do with what we had.
And every now and then we'd get a little break. So there's Brian. We teach them because he kind of set up his table in the back of the room as his little office. So when he didn't have a patient there, I said, Brian, I need to take a picture of you. It was really quite fun. And he said, no, I'll take a picture of myself. I said, okay, I got a picture of that, Brian, and I'm going to find an opportunity to share it. So I'm so happy to be able to share that picture. So, and then we have Monique and one of the faculty members from one of the nearby nursing schools, because we were with several nursing students throughout the whole weekend that we were there. And it was great. It was a fabulous experience. You want to elaborate?
I will. So each of our volunteers was paired with a nursing student. So as the patients came in, the RN would fill out the triage questionnaire while simultaneously the nursing student was taking a set of vital signs and checking a blood sugar. So it was really nice to be able to teach the nursing students how to conduct a patient history briefly, while at the same time they were able to get experience performing skills on patients.
I was thrilled. I had the same student both days. And by the second day, she actually was doing a lot of the triage paperwork herself also. And I was kind of acting as her secretary. So it was really great to get to watch that progression over 2 days of them kind of going from terrified and novice. My poor girl almost threw up at the beginning of the first day. She was so nervous. She also admitted she'd had too much Red Bull too. But it was really fun to watch that happen.
Yeah, I'll point out that we needed to be at the clinic at 5 a.m., so we all woke up at 4 a.m. every morning. So it was a very early day. So there was a lot of coffee drinking involved.
There sure was. And the students that I had, there were some where I had to ask them what level in their education they were at. So some were more proficient than others. So I got to do both what Donna did and Caitlin did, as far as, you know, being the secretary and filling out the paperwork, because the student was very proficient and confident in her skills and asking the interview questions and assessing the client, as well as be the guide in instructing the students and assisting the students to learn something. So it was so exciting to me. When I came back from that trip, I said, I need more clinical. I want to get out of the lab and have more time in the clinical environment. I was so excited. It was a great event. Donna, this is
All right, you want me to take this one?
your.
So I had taken many photos of the different areas at RAM. On the top left, you can just see all the volunteers lined up for the day. That was the first day that we had signed in, I believe, and we were learning how to fill out the triage forms. On the bottom left, you can just see the volunteers paired with the students. To the left of Missy is a nursing student. In the middle is the triage form that we completed on each client as they came in. And on the top right were some parameters that we needed to hold up a sign saying that we needed a nurse practitioner if a client showed an abnormality on their intake form, such as a blood pressure over, don't know if I can read that, I think it's 180 over 100.
It was.
Or if their blood sugar was over 250. So there were advanced practice nurses there that would come over. If somebody's blood pressure was high, they would try by giving them some water, having them rest and recheck. And if their blood pressure remained high, then that client had to go to a medical provider before being allowed to move further on to vision or dental. And they did have clonidine there on site that people were given if they were hypertensive. I'll just
go ahead.
Just one thing about the blood sugars. I think all of us had several instances where our patients came in with elevated blood sugars for a combination of reasons. I had one person who had been in the parking lot since midnight. She said that she had been eating no-nos all night, which and she did not take her insulin in the morning. So she came in with a blood sugar of 318. I also had another 20-year-old that came in with a blood sugar of 215, who she was a known diabetic but did not have a meter at home, never checked her blood sugars, and was not on any medication. So our screening did detect a lot of people that had medical needs in addition to the vision and dental.
Mm-hmm.
I was just simply impressed with the fact that when we identified these people through triage, that the organization is set up in a way that every effort, the nurse practitioners that were on site, the medical staff that were in the medical clinic, did everything they could to bring those blood pressures down, to give insulin, to do whatever they could in order for the patient to be able to travel through and still have their eye exam. If a blood glucose is elevated, it's going to alter the results of the eye exam. So they have to get that blood glucose back down to normal. When their blood pressure is elevated, they can't go sit in a dental chair. So bringing that blood pressure back down to normal while they're on site is the goal. And if it couldn't be done, at least the patient is given the opportunity to go home or spend the night and come back with medication, some sort of treatment, and be re-screened again the following morning for an opportunity to go back in and have the work done that they desperately need.
In the hepatitis, HIV, tuberculosis, and Coumadin screening, all needed to be done before those patients were allowed to go on to the dental clinic, because obviously you wouldn't want somebody on Coumadin having an extraction. So it was very interesting.
I actually had that experience while I was there, Donna. I had an older gentleman that came in with only his pill case. I think he was 84 or 85 years old. I might have even written this in the newsletter. I can't remember. But he had only his pill case with him. His wife sets up his pills. And I asked him what his medications were. And he really did not know. He did not know, and he didn't have a list. We had access to pharmacy students from a nearby university, and they were assisting with identifying medications. So we all worked together in pulling together to try and identify these medications. And one of the first ones that we identified in this gentleman's pill case was Coumadin, warfarin. And he said, "Don't you worry, I took my dose this morning," because we noticed it was missing from that day's medication pill box, but it was in all the others. And he was there because he needed dental care. So of course, as triage, we had to flag that person and make sure that somebody was aware before he even got as far as getting to the dental chair. Maybe there was other needs, and I think he ended up going on to medical.
And that's an excellent point. The pharmacy students were an excellent asset because they provided real-time patient teaching.
It was unbelievable how they were able to identify the medications.
Yeah.
I was really blown away by it.
Did you see how many apps they had? They had
Oh my gosh, yeah.
apps on their phones that they could take a picture of it and it would bring up different medications, and it was just amazing and very effective.
So I'll just add one thing as far as the triage rooms. So I believe there were 3 or 4 classrooms set up for triage. And I have a note here. So the front door opened at 6 a.m. The clients had to go first to a room where their basic information was taken, name, address, and they did not have to divulge that information if they did not want to. But they did need to tell the person if they wanted vision or dental, because they could not sign up for both services on the same day, just because it took too long for the amount of people to go through, you know, for example, like the dental clinic. So if they wanted both, they needed to come to the clinic on both days. Once they went through that first room, then they went to the triage room. And I have a note here. By 10:30 in the morning, our first day on Saturday, 400 patients had gone through triage. So it really was a very well-oiled machine. I have that in our classroom, there were 12 desks. So there were 12 pairs of volunteers working simultaneously. And they had volunteers that acted as runners that would chaperone clients from one area of the school to the next, so that the clients weren't just walking aimlessly in the hall not knowing where to go. And then every time we had a medical issue, we would just hold up a card saying that we needed the nurse practitioner or we needed a runner to take the person to the next area. So I did not feel at all like there were not enough volunteers. There were plenty of volunteers.
Attendees, please feel free to ask questions if you have questions as we're going on. We're really doing this as a chat, so it can be very
Right.
interactive if you want it to be.
All right, I think you can go to the next slide.
Caitlin,
Yes, ma'am.
you good?
I'm good.
Okay.
You know me, I'll speak up.
All right, so these were my photos again. So I just went to every station at the school to highlight what was available. So there were medical services provided, primary care services. So in the upper left-hand corner and in the upper right-hand corner are photos from the room that Dr. Digger was at. So these are nurse practitioners providing primary care services. On the bottom left, there was a mammography van out front. I did make a note that sometimes the clinic offers pap smears, but on the day that we were there, they were not offering pap smears. And then there were volunteers to connect residents with area clinics that you can see here in the middle. That's all I have on that slide. Missy.
Donna,
Yes.
one question. Was that just screening mammography? So what would happen if someone had a breast lump? Were they doing any diagnostic tests?
So some of these patients did have primary care physicians or places that they went. So it was just a screening mammography. So they would be referred for follow-up. And if they didn't have insurance or a primary care physician, there were people, navigators there, that would get them signed up in the marketplace and then refer them to an area they could go, a clinic.
Great,
My
thanks.
understanding too, Donna, is that there were people there to connect people with resources if there was further concern or inability to fill prescriptions, getting medications, and maintaining medications, not just filling them once and sending them home, but
Right.
still long term.
The video that we watched in the beginning said that only 5% of the need at the clinic was for medical services. Most people were there for dental. Vision was second, and medical came in third. So, but yes, the being able to afford the medications was an issue.
Donna, this is Dr. Digger. I'll jump in here and just offer that that they do connect people who need more services, Marguerite. So if someone had a positive mammogram, they definitely connected them. They made sure that they had that follow-up, regardless of the ability to pay. And then the other piece is, I would agree with Donna that the majority of patients I saw needed either medications to get their blood pressure down. So I gave a lot of insulin, I gave a lot of Catapress, and we have most of the pharmacies, Walmart, Walgreens, have a $4 prescription list. So for a 30-day supply of the medications on that list, it's $4. And so all of the practitioners were trying to prescribe drugs that were on that list. So we had some people that were coming in with really chronically high blood pressures. And so lisinopril, for example, is a great drug to start with. And that's on the $4 list. So we were doing a lot of prescribing of things that were really cheap for people to sustain over time.
One thing, Dr. Digger, I just thought of while you were talking, I imagine some of the dental patients needed antibiotics because the one tooth that we saw looked very rotted. So do you know if the dentists were writing prescriptions for antibiotics?
Yeah, the dentists were writing scripts for antibiotics. I think they had some standard scripts printed up already, and then they just had to put the person's information and so forth in them. But the same is true of the antibiotics. They can go and get them for like $4. Okay. And then the only other thing was that we're not allowed to prescribe narcotics, only under very, very slim circumstances. So, and even then it was like for 1 or 2 days. So even the dentists are not giving narcotics. So sometimes they're doing whole mouth extractions and people are managing on Tylenol and Advil. So it's pretty amazing.
Yeah.
That's incredible.
All right, Missy, next.
Okay.
All right, so the next area that I took pictures of were for vision. So on the top left, these are people waiting in the hall, waiting to be seen for their eye exam. So by the afternoon, this hall started to back up. There was actually a big waiting area that people sat in first before they made it to the hall. So here you can see a provider performing an eye exam in the hall to try to expedite people getting through this area. And the top other two photos are rooms that are darkened for eye exams. On the bottom left, you see tables and tables full of donated frames. And then on the bottom right is a picture of a lens cutting machine that was located in one of the Ram trucks out in the parking lot. So the flow was people would get their eye exam, they would get a script for glasses, and while they waited, the lenses were turned into their prescription out in the truck, and then they would leave with their glasses. So it was pretty amazing. But as you can see, it just takes time to get people through that process. Do you guys have anything to add?
I had one patient that was there for vision, and he was a young man. He was probably 24, 25 years old. And the student I was with was really quite amazed because he came with his mom. And I said, well, do you need medical care? We ask each patient, are you going for medical care? Are you going for dental care? And we would know from the forms that they brought to us if they didn't have a medical form to ask them if they had any medical needs. And this young man said, no, I have no medical needs. I just need a vision exam. And one of the questions on the triage form was, do you have vision in both of your eyes? Or that was one of the questions I happened to ask him or something. And it turned out he had a glass eye. He was enucleated when he was a young child in one of his eyes. And he looked at me and he said, could you tell by looking at me? Because nobody ever notices. And I said, no, I couldn't tell by looking at you. I said, it's just a question that I need to ask you. Do you have vision in both of your eyes? And he said, no. And that typically nobody asks him that. And I said, do you wear glasses? He said, no, I do not, but I can't see. His good eye, he only has one. He hadn't been able to see very well for 2 to 3 years. And that's why he was there. And he's never had a follow-up on his enucleation or what. I can't even remember what the reason for the enucleation was. And his mom was there and she says, well, I'm a nurse, so I kind of keep an eye on him. And that was the best he had to offer. It really was. So I said, you know what? You want a medical exam? He was obese. He was a big guy. He said, sure. So I talked him into going down and getting a medical checkup as well. It was just an interesting case while we were there.
There were a lot of cases where people would be very single-minded about getting glasses or just dental work, and often we were able to talk them into it. There were a few cases where people didn't want to wait for the other services. Though it was funny, there was one that was the flip. A grandmother brought actually her 4 grandchildren in, but only one of them was being seen because he needed a physical for school. And we tried to offer medical care to the other children as well as dental, and the boy was really excited about the idea of having dental work. And I'm not being sarcastic. He really wanted to get his teeth cleaned and everything, but the grandmother didn't want to wait for the afternoon. So it was kind of, it was interesting how people sort of had an agenda coming in, and it was difficult at times to get them off of that agenda.
Well, this was also November, so as part of the triage, people were encouraged to get a flu shot while they were there. So
I got my flu shot there.
Yeah, so a lot of people did not, enter the building expecting to be able to get a flu shot before they left. So that was pretty exciting. All right, Missy, you can go to the next slide.
Okay.
All right, so the notes that I have was that this clinic is really dental driven, and the number of patients that are able to be seen on each day depends on the number of providers that they have. So they may have some empty chairs only because they don't have enough providers, but I didn't really see many empty chairs the day that we were there. So what happens is once the patients have told the front desk that they want dental services, they're escorted down to the gym, and they took a seat on the stage. This was the gym, and they were sectioned off into people that needed cleanings versus extractions. I don't know if, I can't remember if just a plain exam was a section or not.
Yeah, it was, and fillings was the other. Yeah.
Okay. So the bottom left photo is a person standing with clean dental trays. So a hygienist would go get a clean dental tray for every patient that sat in the chair. The top middle photo, you can see a client being greeted. These photos aren't necessarily in specific order. So the top right photo are providers gowned up, actually performing exams and extractions. And we lost a photo that we had of a molar that had been extracted. It was in a sterile basin. Somebody took a photo of it, and it was a great photo, but can't find it. But it was this huge molar that had been rotted and extracted, and it was just amazing to see that people were having such big teeth taken out. The bottom middle photo, this is the area that Missy and I ended up being trained at. We're in the bottom right photo. So as the dental trays came through, sharps needed to be removed from the dental trays. So this was obviously the riskiest job at the clinic because there was risk of sharp exposure. So very methodically, Missy and I were trained to remove the sharps, separate the equipment into instruments that could be autoclaved versus things that were disposable, versus things that were chemically cleaned. So I enjoyed it. I don't think Missy enjoyed it as much.
Yeah, I thought we were just out taking a tour, and suddenly I'm being handed a black jacket. Come on, we can do this.
I told her it would be fun,
But
at least we did not get stuck on the bucket brigade.
That's true. Tell them about the bucket brigade.
So the oral secretions that were suctioned at each table obviously had to go somewhere. So these secretions went into pails that were then brought to the back dirty area of the gymnasium, and then they were, I can't remember how they disposed of them outside. Do you remember?
They said they isolated them in a specific area in the gymnasium so that they could be put onto the truck and gone for medical waste, or somebody was going to pick them up specifically at the end of the event.
Yeah. So luckily we didn't have to look in the buckets, because
no. No, we did not look in the buckets.
But Missy, if I decide to go on the next one, we could be, we could be beneficial to the clinic because we went through this training.
This is true. This is
true. They were very good about explaining everything. So, okay, you can go to the next slide.
I have a question. Did you guys get by any, it's sounding like you didn't get to pick where you wanted to go or what jobs. Were you given choices, or were you just assigned things?
Well, I'll talk to that. So we were assigned to triage, but what would happen is triage area really wound down by 12, 1 o'clock in the afternoon. Because at some point, the front desk stopped allowing people to come into the building because things got backed up. So you could see on the stage all those people waiting for dental care. So we were assigned to triage, but our day really finished by 12 or 1 o'clock. So then the volunteers just walked around to see where they could be helpful, which was how Missy and I ended up at the dental area, because that's where they needed help. So
if I ever go with you, because I am not good with secretions, I should avoid the dental area at all costs.
yeah, just don't walk over there and say, what are you doing?
Don't be part of the bucket brigade.
That was kind of what I did.
Yeah,
I
you
would go
did.
stick my head into the dental area, get dizzy, and walk back out.
Yeah.
Yeah, Caitlin kept popping in and out. I wasn't sure what that was about. So there's a picture, there's not. And the other thing was it's clearing those trays. There was a biohazard box down below us where all of the tissue, there was an amazingly large amount of tissue and
teeth.
and teeth that came off of those trays. So sorting included kind of leaving the tissue and things like that to last, so that you can dump it in the biohazard and send it on to the autoclave.
Right, and the bloody gauze and all that stuff. Yeah. All right, so the next area was for hearing. There was a classroom set up for people to obtain, what is this called? It's where you see instead of hear on the phone. I'm trying to, closed captioning.
Closed caption, and yeah.
It's TDD, but I can't remember what it stands for.
Yeah.
But they did have hearing exams there. All right, so you can go to the next slide.
Okay, whoops.
All right, and then I went around and I took photos of the different education that was available. So on the top left was in the library. There was information on PrEP, which I believe stands for pre-risk exposure prophylaxis.
Yes.
So for people that engage in high-risk sexual activity for HIV exposure, there is now prophylactic medication. And I was very interested in that because I recently had a patient who in his chart said he had HIV. So I asked my patient, how long have you had HIV? And he said he does not have HIV. He takes PrEP to prevent HIV because he has sex with men and he currently is not in a monogamous relationship and his health insurance covers that. So I thought that was pretty exciting that insurance will cover that. On the bottom left were some educational materials for breast cancer prevention. And you can see in the case there were some breast molds that people could feel lumps within and wear in their breast to check for different types of lumps. On the top right were depictions of how much sugar is in different types of food, soda, Red Bull, candy, that sort of stuff. So the three things that I just talked about were for health education for clients and for volunteers. And then on the fourth, bottom right, was the opioid overdose reversal training, Revive. So for registered nurses, we all left the clinic with 2 doses of Narcan, which I have in my purse. We were trained to administer Narcan, and the state of Virginia has a blanket prescription that anybody that goes through training can leave the training with doses of Narcan. So, and I did find out, I asked the pharmacist where I go if New York has the same type of blanket prescription available for people trained, and she said yes. So but I was glad they said not to keep the Narcan in your car, because that's where I probably would have kept it, because it'll freeze in the cold. So I keep it in my purse, which is funny because I recently went through a metal detector and the sheriff pulled the Narcan out of my purse and was kind of giving me a look. And I had to explain to him that I don't use heroin, but I have that because I'm a provider.
That's funny.
Have you guys thought about doing any kind of education the next time you go down?
That's a good question.
I think every time we go there, I think we participate in patient education from our standpoint. You know, there's a lot of education involved. I know I came back wanting to be more involved in student education. I was really excited about, you know, being able to play or being able to participate in that role as an educator, working with all the students for the weekend. I'm not sure where would be the most useful. You know, it depends on the clinic. I think different clinics, Dr. Digger, you could probably correct me if I'm wrong, different clinics may offer different trainings.
She had to step away.
Okay, that's fine. So you can see from this slide here, even Becky, that, you know, we as volunteers were offered training. We were trained when we left. On the left here is me with this, the nurse that ran the triage rooms, the triage room that we were in. And while we were there, we actually were helping to run the room by the end of the clinic. So she says she's certified us to run a triage room. So we could actually, at the next event, run a triage room if they needed it, or be a triage nurse, either or. And the Revive training is exactly what Donna was just speaking about. That was the opioid overdose training. And of course, we were trained to and cleared and certified to clear dental trays. That's Caitlin, who couldn't enter the dental area. Sorry, Caitlin.
I have a question about that Narcan training. Would the participants get Narcan even if they were not nurses or other types of providers? Was this training for the general public, or is it just for providers?
That was a provider training, if I'm not mistaken.
I was just curious.
There were teachers there, though, weren't there?
And didn't the nursing students end up?
Yes, they did.
So you did not need to be licensed.
Okay, that's good to know. That's great that they're doing that.
Yeah, you had to have your name on the list and be certified. That was it.
I know there's a park in Pennsylvania, and there's a library located in this park, and all the librarians have been trained on Narcan delivery because the park has such a high heroin usage rate, and they use their Narcan regularly, unfortunately.
Wow.
Yeah.
I keep mine in my office at work. You know, I'm on campus. You never know.
Yeah.
I'm the same.
Yeah, and we were given 2 doses. This is nasal Narcan. We were given 2 doses because the first dose will wear off.
About 20 minutes, I think. So.
Yeah. And sometimes they may not respond to the first dose and you need to give the second dose right away. Okay, next.
And there's the end. You can see that by the end, I thought it was interesting that remote area medical of Virginia, the clip that Caitlin showed to begin with, talked about local areas and their investment in RAM. And Virginia really has a huge investment in the RAM program. And they help so many thousands and thousands of people every year. So this, I just loved this poster outside the dental area. And I also loved the end of the day, we've got Donna and Monique and Brian sitting up on the stage in the dental area as the dental area was finally clearing out on our last possible moment. We were exhausted, but it was the best trip ever. And Monique is waving goodbye to us.
What were the hours? I know you said you had to be there by 5 a.m. What time did you finish up on in the evenings?
I think we were out. Well, the first day we were surprised because there were so many volunteers. really, you could only do so much in the dental and optical areas, and that's where it was really overloaded and backed up. So I think we ended up leaving by 3, I think.
Mhm.
Oh,
That sounds about right.
And then the final day, we, of course, had to get on the road. So I think we wrapped up around 1 or 1:30
Mhm.
and left.
But it was just amazing that people got to the parking lot at midnight.
Oh, it was.
So they could get in line when the doors opened at
Mhm.
6. And there were porta potties in the parking lot. The first day that we were there, it was pretty warm. It was like 70. This was the beginning of November, but it got cold that evening. So people were in their cars running all night because they were cold. They hadn't slept. Surprisingly, I did not come across anybody that was rude or complaining that they had to wait. I did have one woman who was Hispanic that did not speak English, and that was a gap. There weren't enough Spanish-speaking volunteers.
So anyone have any questions? Caitlin, do you want to add or show the final clip?
No, I think I'm all set.
Do you want to show the final clip?
Yep, absolutely. Give me 1 second.
Thanks for being here, everybody. This is awesome.
Thank you. Great to hear about your trip.
Well, we don't usually get into these, Zoom Hollywood Square things or Brady Bunch gang here.
Great job. Is Dr. Digger back?
no, she's done for this afternoon.
Okay.
I was just going to say, this makes me want to go to the next one. I wasn't going to.
Oh, Donna, come on. I'm already signed up. You got to get your Virginia license. So that's the first thing you have to do.
Oh, really? You have to get your Virginia license in order to go down there and do triage?
Yeah.
Temporary license. Yeah.
But we already got a temporary. Do we have to get another one?
Yes, we do.
Yes.
That was date specific.
Are they part of the compact or do they not?
No. Well, New York is not part of the compact. So.
Oh, okay. And where'd you say the next one was?
Smith County in Virginia.
Who?
Again, Smith County,
Smith County.
Virginia.
It was about an 8-hour drive. Where were
Just
you?
outside Cripple Creek.
You want me to start the video?
Yeah.
Sure.
Okay.
Very
I
sure.
plan to have some teeth extracted today. Chris,
Is that super quiet on everyone else's, or is it okay?
It was good.
Okay.
I plan to have some teeth extracted today. Chris had told me about it. I had not seen it in the news or anything. He had told me about it, and he said I should try to come here to see if they can do what I need done. And it's free, and that is very good for me. I'm retired, and that's all I have. I have Social Security, and I have a pension, a small pension, and that's what I live on. I would like to tell them I appreciate it and thank you. I just can't believe they do this and volunteer.
And that is the epitome of the clients that we met down there. They were all so grateful. They were so happy to be there. They were helping each other. They were watching each other's kids. It was really a very worthy event.
So, yes, Dr. Digger was talking to the organizers about getting one organized in the Delhi area, correct? Because there's a need, obviously, in New York. There's a lot of rural areas with underserved residents. So that's something that she's looking into for the future, so that we don't have to take SUNY Delhi students to Virginia, but to do something closer to home.
We could have the Virginia students come up to us.
Right.
There you go. Yeah, we traveled the furthest. We did win that award.
Now, where did y'all stay at night? In a hotel, or did they put you up somewhere, or?
Hotel. We stayed in a hotel.
Yeah.
And I know you said you used your assessment skills and vital signs, blood sugars. What other kind of nursing skills did you guys get the opportunity to perform while you were there?
Oh my gosh. Well, obviously, there were quite a few patients whose assessments were abnormal. So going down and helping in the medical clinic and going over to the dental clinic, of course, there weren't things like, you know, dressing changes or anything like that, Becky. It was.
Some of it was just emotional support.
Yeah.
One thing that I remember was I had a young guy, maybe 19, who told me that he was a recovering heroin user. So can't remember exactly how the conversation got started. I think he might have had hepatitis C, but just to be able to get into a conversation with him, with my nursing student who was the same age as him, about how he's in recovery and what a wonderful thing that was, and he's an inspiration. And we just kind of like really praised him for being able to, you know, positively work on his health.
You know, I think as an educator, being able to be with the students and provide, you know, an example of being thorough and what kind of documentations and what kind of things you need to question more and those kind of things. It was really very worthwhile.
And not to be judgmental on people, you know, that don't take their medications, but to ask why they're not taking them.
Mm-hmm.
I think that's it.
Okay, everybody.
Thank you very much. I thought that was neat.
Yeah, thank you.
Thank you.
Thank you.
I hope you enjoyed it. We certainly did. So we love talking about it and sharing it. So.
Take more pictures for this next one.
Yeah, we'll keep the phones closer, the cameras closer. Thanks, guys.